Hi, everyone. I am Anise Raouf. I am the Arts and Health Grants Program Manager at the Rhode Island State Council on the Arts. And we're going to talk about the Arts and Health Grant, and we're going to walk through the application and guidelines. Just to give you a brief agenda, I'm going to introduce the program goals, eligibility requirements, funding rules and restrictions, how to start your application, evaluation criteria and definitions. We'll walk through the application and how to find out more help. To start out with, to introduce the program, the Arts and Health Grant supports non-clinical art programs with health-related goals that take place in health-based or community spaces. This grant funds both non-clinical arts engagements that promote and facilitate individual health and art activities that address the social determinants of health to provide a community health benefit. And when we refer to the social determinants of health, these are the non-medical factors that influence health outcomes. They're the conditions in which people are born, grow, work, live, and age. They're the wider set of forces or systems shaping or the fundamental drivers of these conditions. The arts and health grant category is grounded by RISCA's recognition that arts and health contribute to a thriving community. The arts have the capacity to transform the lives of individuals and communities, contributing to health, well-being, and overall resilience. Arts and culture can facilitate the physical, cognitive, and social emotional aspects of individual healing, and that when applied to public health, promote healthy environments and policies in communities by fostering empathy, awareness, and social cohesion through shared narrative and aesthetic experiences. This program awards grants up to $9,000. And who can apply? The applicant would be an organization, not an artist. So a 501c3 nonprofit organization based in Rhode Island, or groups fiscally sponsored by a 501c3 nonprofit organization based in Rhode Island. Eligible organizations may also include health-based, social service, faith-based, community-based, or arts and cultural organizations. The deadline for this program, there's only one grant cycle for the Arts and Health Grant, and that's this cycle, which is the spring deadline of April 1st, 2024. Grants open for the applications. They opened on February 1st, and they close again April 1st at 11:59, and it's a hard cutoff from the grant system. It automatically turns off. The funding period for this grant supports projects beginning in the fiscal year for RISCA, which will be July 1 of 2024 and June 30th, 2025. This grant, part of the eligibility, two main components, and we'll get into other eligibility requirements a little later on. This funds art experiences that have intended health or public health benefit. It also requires consultation with a health professional and or subject matter expert. And this is very important. It distinguishes this from maybe project grants from organization or education grants. Program priorities. Specific to health, the goal is to utilize the arts to enhance the quality of life and create an environment conducive to healing for individuals, patients, caregivers, and or staff. And if it's a public health project, the goal is to utilize the arts to build healthy communities for all Rhode Islanders by generating awareness of the social determinants of health and to promote the arts and artists as partner in the health-related strategies. Another priority is showing connection to the Rhode Island State Arts Health Plan. There's more information about that State Arts Health Plan in the resources and in the guidelines. And 5 of the main focuses is patient care, employs art as part of the treatment, healing environments, the physical space design, as well as what happens in these spaces. Caring for caregivers includes professional, paraprofessional, or informal caregivers, such as family and friends. Involves education, improving clinicians' diagnostic tools, empathy, resiliency, observation, and communication skills, and community well-being, using the arts to address public health concerns such as health literacy, health equity, and trauma resiliency in public areas. And the expectation is not to cover all these program priorities, but that you touch on one of them. Also, collaborative art projects that co-locate our activities in health and social service facilities and programs, or partner health organization professionals with arts organizations and artists. And this is just again to show that this is a collaborative process between arts and health and bringing in the appropriate partners to carry out the program. There are additional resources. There's an art and health glossary. There's a link here and also in our guidelines to give you definitions of some of the terms that we're referring to give you a better understanding of what we mean through arts and health, a link to the State Arts Health Plan, and also from the Department of Health, their strategic framework. I'm also going to give some examples of the hypothetical projects. So in terms of health, one example would be an organization offers an interactive music program to stimulate memory and cognitive awareness for individuals with Alzheimer's disease or dementia. Another example would be a substance misuse treatment center offers a series of workshops presented by professional artists in mediums such as dance, movement, singing, painting, storytelling, poetry, and/or writing to enable participants to explore their own experience, build a sense of belonging, and develop skills that will assist in their ongoing recovery. And another example could be a dancer or dance company offers an adaptive dance program as an artist residency at a rehabilitation center or long-term care facility for residents and staff. As far as public health, one example could be a homeless shelter partners with an artist to create artworks that communicate the experience of homelessness. And the resulting works are displayed in a community center to build understanding of the causes and challenges related to homelessness. Another example could be an arts organization and a social justice nonprofit partner to create and promote a public performance that delves into the connection between racism and health outcomes. A post-performance event features a series of community conversations to encourage ongoing dialogue about racism and its impact in the local community. And another example could be a senior center and a school co-organize an artist residency to present oral histories, writing, and visual arts workshops. Seniors and students tell, write, and illustrate stories, facilitating intergenerational connection and reducing social isolation. The event culminates with a publication of a book, public readings, or an exhibit at the senior center and school. And again, these examples are not the only possibilities, they're just sort of give you an idea of how you can think through a project. Other eligibility requirements we touched on in the beginning. You must be a nonprofit organization. The applicant, again, is an organization and not the artist. And we understand the artist is integral to this project, but they're not the applicant. So the nonprofit is conducting business and being incorporated in the state of Rhode Island as a 501c3 with tax exempt status from the Internal Revenue Service. They're registered with the Rhode Island Secretary of State. They're governed by a revolving board of directors, trustees, or advisory board drawn from the community at large and shown to be actively involved in the governance of the organization. A non-exempt Rhode Island-based organization using a fiscal sponsor that also fits the above requirements. And just as a note, because sometimes there's big healthcare institutions, an umbrella healthcare institution may submit up to 2 arts and health grant applications during the same cycle if they're submitting different project proposals on behalf of the different facilities. So divisions, branches, departments, programs, or other subunits of nonprofit corporations, colleges, universities are ineligible to apply on their own. And also the application may be submitted only by the parent corporation. For out-of-state organizations to be eligible, they must show their principal place of business is in Rhode Island. They must be registered with the Rhode Island Secretary of State's office, produce programming predominantly in Rhode Island, and be governed by a revolving board of directors, trustees, or advisory board drawn predominantly from the Rhode Island community. A little bit about a fiscal sponsor. If you are applying with a fiscal sponsor, the non-exempt Rhode Island-based organizations can apply via a fiscal sponsor, which is an organization registered with the Rhode Island Secretary of State office and can accept the grant on your behalf. They must be financially, administratively, and programmatically responsible for all conditions of the grant. Organizations interested in using a fiscal sponsor must contact the program manager prior to beginning an application for approval and to request a grant profile that links the organization to the fiscal sponsor. Nonprofit organizations asking as fiscal sponsors can also apply for grants in their own programs or awardees. We have some organizations that get grants on their own, and then that doesn't preclude them from being fiscal sponsors for multiple organizations because they're not the actual grantee. Typically, a fiscal sponsor will charge an administrative fee, sometimes ranging from 0 to 10%, depending on the degree of administrative support and bookkeeping required. And the fiscal sponsor must fit RISCA's definition of a nonprofit organization, as we stated above. They're responsible for signing any of the grant documents and ensuring that the organization follows the rules of the grant program and submits their final report. So if there's any overdue final reports from that fiscal sponsor, that would make them ineligible to be a fiscal sponsor. Everything has to be up to date. If there's any questions, you can ask me. But they cannot be a project partner in the sponsored organization's application. There's definitely a distinction between being a project partner and then just being a fiscal sponsor. You are ineligible to apply for this grant if you are receiving general operating support for organizations funding from RISCA in the same fiscal year. If you're applying for support for this project or aspects of this project through another RISCA grants program, you may apply to other RISCA grant programs for different projects. Or if you're delinquent on any final reports for previous RISCA grants, you need to have those all turned in before you would be eligible for this grant period. Funding rules and restrictions. All grant awards are contingent upon the availability of funds from the Rhode Island General Assembly and the National Endowment for the Arts. The maximum grant award in this category is $9,000, but partial awards are common. The grant applications are considered on a competitive basis. Award amounts may vary cycle to cycle depending on available funds, number of applications, and the panel decision making. The panels change each time, so their view, changes who's in the room. If you receive a partial award, you won't be expected to accomplish the project as initially outlined. You may reach out to staff to discuss project modifications at any time. So for example, if you ask for $9,000 and you're awarded $4,500, we don't expect that you're going to carry out the project exactly the same way. We understand that you might need to modify it as long as the intent is the same. If you get other funds from other sources, you may carry it out just as you had originally planned, but we definitely understand that changes may be made. You also have the option of declining the grant award with no penalties. If you don't get the full award, we understand that might change your ability to do the project. Also, we understand things might change from the time you apply for the grant and when you get notification. And there is no penalty. Again, there's no mark on your record at all. We totally understand that. And if you receive a grant, you must credit the agency on all marketing materials. And there is a link to our website on how you would do that. We have new logos and new branding and how that would work in color, black and white. Allowable expenses. This grant can be used for expenses related to your project and its production or presentation, including marketing and accessibility efforts associated with the project. If you're using an RFP or an RFQ process to select artists for a project, funds can be used to pay the artists, and these are considered stipends and must be publicly communicated as such. Programs must also incur in spaces that are American with Disabilities Act, also known as ADA compliant, and you are ineligible for a RISCA grant if your facility does not meet the ADA standards. And for more information, we have a link to the National Endowment for the Arts checklist. All funded project activity must take place in Rhode Island. Not allowable expenses. Grant funding cannot be used for the following. We also understand, just as a caveat, that the project itself might have other funding involved and there might be other expenses, but the funds that you ask for and use RISCA funds for are not allowed for these following expenses. Capital projects, including the construction or renovation of buildings or addition to buildings, development efforts such as social events or fundraising, addressing, eliminating, or reducing existing debt, the purchasing of alcohol, food, or beverage, prizes and awards for an event, person, or organization, regranting, activities that are associated with a graduate or undergraduate degree program for which academic credit is received, applications for projects that proselytize or promote religious activities or which take place as part of a religious service. There are some grantees that, they're a religious agency that act as a hub for other organizations, but they're not actually part of a religious service. So there's a distinction there. Programming, performances, and exhibitions unavailable and or inaccessible to the public, and expenses incurred or activity happening outside of the award period. The panel that makes decisions on these grant awards is not the RISCA staff. RISCA staff are not panelists. We help facilitate the process. We're available before you submit your application. We're able to look at drafts because we are not the ones deciding the actual grant. So the panel is made up of 3 to 5 individuals. There's diversity along a number of metrics. At least one is a professional artist. It also includes individuals who work in the arts and or health sector. Also individuals who may work at a state or local arts agency or similar vantage point in the arts and cultural ecosystem. And definitely there'll be people there in the health sphere. Panel reviewers will use the evaluation criteria to evaluate and recommend applications for funding. And we'll go over the evaluation criteria a little bit. So starting your application, there are things to gather as you plan your project. So one of the things, here is a list of things that will determine eligibility. So you need your 501c3 determination letter. If you're not a 501c3 nonprofit, that's where you might look towards a fiscal sponsor. So you need a letter from that fiscal sponsor. Organizations need a SAM UEI, which is a 12-character unique identifier assigned by the federal government. And that's a free service if you don't have one already and you need to sign up for one. There's a lot of scams out there. It is free to have and necessary. You also need 990s from the past 3 fiscal years. And if you're using a fiscal sponsor, you need your fiscal sponsor's determination letter, their SAM UEI, their recent 990s, and the letter. Then support materials that the panel will use to review that will support your application. A project budget outlining the project, and we have a template that's on the website, which must be used. That is a requirement. Don't use another spreadsheet or budget template. CVs or resumes of artists involved, because arts is at the center of this project. CVs or resume of the health advisor or subject matter expert. Artistic work samples can be helpful to illustrate the quality and the relevancy of the artist for this project. An evaluation form of the health or public health impact is optional. We ask that you describe how you will measure the health or public health impact, but an actual form is not a requirement, just optional. Other optional uploads may include letters of support, partnerships, evidence of the public health need, and other things that might make a case for the importance of this project. The evaluation criteria and definitions. So we ask that you read these very carefully. This is what the panel will use to evaluate your grant application. And I know sometimes applicants think that it's really important to say more about other things that are really important, but the panelists are looking at lots of applications and they're going to be scoring and judging based on this criteria. So and the questions that are on the application are focused around this criteria. So one of the best things that you can do is really read the criteria and then answer the questions with this in mind. And that will make it clearer for the panel to evaluate the project. So half of the criteria is based on health impact, access, and engagement. So the question is there evidence of a positive health impact on the individual and or community? So things to consider would be, is it thoughtfully conceived project concept? Does it have the capacity to deliver appreciable health or public health benefits through the non-clinical art experiences? Does it describe the target audience and population to be served and why they might have a health benefit from this art experience? Is it appropriate and does it align with the participants' needs and abilities? Does the project plan anticipate and remove barriers to provide physical and programmatic access to the individuals of all abilities and underserved populations? And does the project show evidence of engagement with the health professional and or subject matter expert or community partners as described by the project? And does it show evidence of impact as defined by the scope of the project, health or public health? The next piece is the artistic integrity and relevancy. This is 25% of the score. Is there evidence that the arts are relevant and integral to this project and centered in achieving the health goals? So again, the arts engagement is central to the project. The evidence that practicing artists can provide relevant and respectful engagement with the identified population. And this is important. We understand there's lots of really talented, well-trained artists that are amazing. But what's important is also, does that art match the participants that it will be involved in this project? Is the art form also relevant for this project and to deliver the health or public health benefits? That relevancy is very important. So as far as health, the artistic experiences are centered in achieving health goals. And for public health, that artistic experience are centered in achieving the public health goals. The last part of the criteria is feasibility. And is there evidence that the project will be carried out successfully as defined? Is the project clearly defined? What does it include? What will be done by whom? When and where activities will take place in the population that will benefit? Does the applicant have a clear definition of success and specific metrics to measure that? Are the project collaborators present appropriate? Do they present appropriate qualifications and experience with the defined project? And are the budgets clear, detailed, and accurate? And the planned allocation of funds support the project goals? So now we're going to just take a walk through the application. And I'm going to just pause this for just a moment while we walk through it. Okay, we're going to walk through the application. You will log into the Foundant, which is the RISCA Rhode Island, the RISCA grant portal, and you will get to the home page. You will see the list of grants that we have open, and you will scroll down to the Arts and Health grant. When you click on apply, you will get to the application. It starts out with an overview, some few things to consider that we went through. It'll have a list of guidelines and template forms. So it'll have the guidelines here you can download. They're also available on our website. There's a checklist, just a quick checklist of things you need to gather. The project budget template, as I mentioned, in an Excel format, an evaluation rubric, which will have the same information that we just discussed as far as the review criteria, a sponsor letter if it's needed. There's also a list of definitions, the Arts and Health glossary and other terms, just to get you familiar with what we mean by these different arts and health terms. And then before you start the application, there's an eligibility quiz. And this is the piece that you will read and answer questions, and that the risk of staff I will be looking at before it can move to panel. So just as we had gone over things, you're answering questions about your nonprofit status, the ADA compliance, did you consult with a health professional, and that the money will not be used for ineligible items. Then we get to the next section, which is info for the panel. So we try to make it very clear what the panel will be looking at, because it's not important for them to see the eligibility part that the staff is reviewing. So who you are, just list the name of your organization, a mission of the organization. There's a project overview, just letting us know if this is going to be a health or public health project, health or public health project. What's the name of the project? Very short. And then the project summary. And we ask that you keep this brief. We want you to know in just 2 or 3 sentences who the target population is, the art experience, and the health or public health benefit. And this is actually the public facing piece that when we used to promote this project, that it would be the summary of what it is. And so it's important that this be brief and succinct. The amount requested, where the project will take place. Sometimes it's at the facility of the organization who's the applicant, and sometimes it might take place elsewhere or in multiple places. The project start and end date. And for example, as I said, this project can take place anytime between July 1 and June 30th. It doesn't have to take up the whole time, just it can't be outside of that time period. We ask you, and this is just for collection, who is the target population, and you can click as many as people that you'll be serving. Is it a pilot or existing project? And then the project description. Summarize the project you're proposing. Here's some questions, and again, they relate back to the review criteria. So a few narrative questions, and we also specify 2 to 4 paragraphs or 1 to 3 paragraphs. We want it to be clear that you don't need to put so much information, but not so brief to answer the question. Again, just letting us know the connection to the state arts and health plan. You can click what is part of that, or if it's not applicable at all to this project. Describing the programmatic access, how it is accessible to the population that has been defined. The health or public health benefit. And so again, this is just to explain, what do you expect the health or public health benefit to be, and how will you measure that? So we give some examples there. And then success. How do you define success? What does success look like for this project? And then again, that can be different for different programs. What that means, is it for the staff? Is it for the attendees? Is it for the public health announcement, changing people's minds? So you will determine that. Project timeline. This is also important. It doesn't have to be elaborate, but we want to know what's happening when. In July, are you hiring the artist? Are you planning the program? In August, are you starting the program? And it's lasting 8 weeks, and then is an evaluation happening? It can be simple, but it just needs to be clear. Then we want to know who is on your team. So who is the project coordinator? And that could be, so we want the name of that person and what their title is. Who's the subject matter expert? This might be the same person as the project coordinator, but we understand that might not always be the same person. So we want to know just the name of that person and what their role is. And then the name of the artist or arts and culture partners. There might be more than one artist. Name of other partnerships or collaborations. So in that top piece, we just want the names and roles of those people. Then there's a narrative section where we want you to briefly explain who these people are and why they work together. Why are they, in your words, why are they important to this project? Why have you selected them? So then there's a support material section, as we had gone over. Some things are required and some are optional. So again, the project budget template is required, and also really important that you pay attention to the uh, forms and how they're saved. So the project budget needs to be in Excel or PDF. Any other form like Pages will not be read by the system. So you want to make sure and test it once you upload things. The CV of the resume of the artist involved, the CV of the health advisor or subject matter expert, artistic work samples if relevant. An evaluation form, as I mentioned, is not required. And then there's spaces for other support material, links to websites if you want to include. Then this part for the eligibility, again, this part, it clearly states it's for the risk of staff. So the 501c3 determination letter, inputting your SAM-UEI, the 990s. We want to know who your legislative district is for us to collect. We want to serve the entire state of Rhode Island. So we are collecting that information. And then there's a series of questions the panel will not see. It's not relevant to the application review process, but as we get funding from the NEA, we need to collect data. So there's some questions here, very simple questions. There'll be more in the final report that, again, not too complicated, just trying to collect data. And then there's insurances at the bottom. You just sign and submit the application. I'm going to stop sharing right now. So I just want to leave you here with some helpful resources. Again, on our website, the grant guidelines at arts.ri.gov grants. We also have webinar recordings on and other videos on YouTube. There's a really brief budget tutorial, which is great. We have drop-in and office hours on Zoom and one-on-one meetings. You can always email me at anisa.raouf.int@arts.ri.gov. And again, because I'm not on the panel not on the panel review committee, I am available to answer questions, review the application. And we suggest you don't wait until the last minute. We will get busier and busier up until the April 1st deadline, and we'll have less time to help and support as we get busier. So I want to thank you and have a great day.